you said there are so many pros and cons to use that technology. Maybe you can tell your own pros and cons.
Sure, absolutely. The ability to precisely change DNA sequences means that we have the potential to treat, possibly even cure, terrible genetic diseases, to try to treat new types of cancer, to help bring new foods to an exploding global population. These are all obviously incredibly exciting, helpful applications. There's also sort of a raging debate around other potential uses, like editing human embryos. And for us, that's a really clear line that we're not going to cross. We're not comfortable with editing human embryos for any purpose. And we even have started writing that into the contracts that we sign with other companies, preventing them from using our technology to do that as well.
I also read articles about like changes in DNA that also change behavior. Like for example with ants. Is that also something where you can use technology to really change behavior?
It's a really cool question. Not something I've ever thought about before. Most of human biology is so complicated. Any individual attribute in our body, let alone our personality, is a combination of so many different genes working together. So I think there are very few ways to draw a connection between one tiny tweak in the DNA and a profound impact on someone's behavior. I think really what everyone's focused on right now are devastating diseases that are caused by one mutation in the DNA, with the hope that we can use this type of technology to correct that mutation and treat the patient.
This sounds that it sounds that it will come in the next years, but how long will it take till it gets like real therapy?
Developing a new drug takes a long time, mainly because you need to prove that it's safe and efficacious. And so that takes many, many years of work, first in the laboratory and in animals, and then ultimately in human trials before it would ever be an approved commercial drug. And so we're starting to see the first clinical trials kick off. Supposedly the first one started last year in China. There are ones based on U.S. company work and U.S. company labs later this year, early next year. So we'll get a first hint in humans in the next few years. But it's going to be 5, 7, 10 years until there are any real products on the market.
But it will come.
I hope so.
Okay, but you also, maybe also because of your session tomorrow, you will talk about like under the topic, nothing to be afraid of. Aren't you sometimes a bit afraid because you know what could happen, what's going to happen more than like normal people?
Yeah, I think with any great technological innovation, there are positive, helpful ways to use that innovation and then potentially harmful ways. And so we feel really strongly that there need to be robust dialogues and debates internationally around what's acceptable and what's not, and how we as a community prepare for other groups behaving in a way that's outside of what we find acceptable. We're in the early days of those types of conversations, but there's a lot more work to be done.
Perfect. Thank you very much for your time.
Thank you.